So next the topic, as you can see, the most important topic of the lower limb, that is femoral triangle. Okay, so in femoral triangle, as it's a triangle, so we know when we study any triangle in the body, we always study in the form of headings like the boundaries and its contents. Now boundaries, as you can imagine, if you are sitting in a room, you can imagine the boundaries will be there. The apart from the walls, what will be the boundaries? The roof, the floor, okay, and then the contents. So now you see the boundary. So it's a triangular depression, it's a femoral triangle, triangular depression. So there are some boundaries, which is the base is formed by the inguinal ligament, medial boundary and lateral boundary is formed by some muscles. Okay, that is the medial border of both. So please remember this very classical thing. I'll show you in the photograph. Medial border of adductor longus and medial border of sartorius. I will show you in 3D also. Then the apex. So if there is a base, there is an apex. Okay, so apex is the meeting point of the medial and lateral borders. And then you have floor, which is formed by again all the muscles. Okay, so these muscles are very important. The nomenclature, the sequence is important. And then we have the roof, which is formed by the skin, superficial fascia and deep fascia. Okay, so let us see these boundaries in the form of a photograph first, and then I will show you on 3D. Okay, so same. Now you can see the first one, as you can identify the landmarks, the bony landmark. This is the ASIS, anterior superior iliac spine. So this here would be the pubic tubercle. Okay, here would be the, sorry, this pubic tubercle, here would be the pubic crest. This is the pubic bone basically. Okay, so you can see this is the inguinal ligament, which is attached from the anterior superior iliac spine to the pubic tubercle. We will come to that when we will discuss the inguinal region. But you see the muscles. So you remember the previous muscle which we discussed just previous to this video. This is the sartorius muscle. And here we discussed in the 3D previously also, if you remember, the adductor longus muscle, the medial muscle. Okay, and this is the muscle which is getting ossified to form the rider's bone. Okay, you have studied the sesamoid bones in the general anatomy. So here you see the boundaries. Now this is the triangle which is formed. Please pay attention for a second. This is the main catch point to remember. Again I am repeating, this is not the femoral triangle. Okay, the femoral triangle is till this part. So that means what? So we are talking about laterally, it is the medial border of the sartorius, but medially it is the medial border of adductor longus. Unlike wherever you have read any triangle, you might be thinking it is this boundary. No, this is not the boundary, this is the boundary medially. So medial border of both the muscles, that's the main catch point which is tested in the exams. Okay, so what are the muscles which are forming the floor in the femoral triangle? So I think you have heard these names previously also. So the muscles in sequence is very important. So this would be the lateral side, this would be the lateral side, and this would be the medial side, sorry, medial side and lateral side. Okay, so you can imagine, so there was iliopsoas tendon, if you remember here, which was coming psoas major, iliacus. So iliacus, iliac fossa, there that muscle is more lateral to the psoas major. So you can remember that way, iliacus first if we talk from lateral to medial. Then you saw psoas major tendon, which was more medial to the iliacus. Then you have a muscle that is pectineus. We will come to it in a while. Pectineus muscle in the medial compartment. And then you have the adductor longus. Okay, so these are the sequence of the muscles from lateral to medial. Okay, so this sequence remembering is very important, and the first two are very difficult. So this is from lateral to medial. Okay, so you remember that cubital fossa where you studied the mnemonic MBBS, MBBR, right? So that was from medial to lateral. So mnemonics, wherever you are studying, just giving an example, wherever you make mnemonics or wherever you remember sequence of structures, be it contents or floor or anything, please remember whether you are learning from medial to lateral or lateral to medial, because that will change the game in the question. Then we come on to the boundaries we have cleared. Okay, then we come on to the contents. Okay, so contents are the same things which you might be expecting, that is the femoral artery and its branches, femoral vein and its tributaries, then femoral nerve, again a catch point here to remember, I will come to it in a while. Femoral nerve is not the content of femoral sheath, okay, it is lying outside the femoral sheath, that is very important, but it is a content of femoral triangle, okay. Then lateral cutaneous nerve of thigh, okay, these are all important ones, okay. Then you have femoral branch of the genitofemoral nerve, again a very important nerve, we will come to it in a while again. Then femoral sheath, super duper important, you cannot skip this femoral sheath, it's very important, short note also in your theory exams as well as in your MCQs also it is tested, okay, from the lower limb. Then you have deep inguinal group of lymph nodes, okay. So let us see these contents in the photograph, that I will show you in 3D everything together, okay. So can you see this structures here, that is the femoral vein is lying medially, that is the main point to remember. Then lateral to femoral vein you have the femoral artery, and then lateral to femoral artery you have the femoral nerve, okay. But there is another nerve, that is the femoral branch of the genitofemoral nerve which is present here, okay, which is again a part of the femoral sheath. So femoral sheath is having some contents which will come in a while. So the femoral branch of genitofemoral nerve is the content of femoral sheath, but femoral nerve is not the content, okay. Then I am repeating this fact again and again and again because it is super duper important, you cannot skip it, okay. Then there is another nerve which you can see here, that is a lateral cutaneous nerve of thigh, okay. So this this nerve can actually have some variation. If it passes deep to the inguinal ligament, then it becomes the content of femoral triangle, okay. So you on dissections you can find this thing, but suppose if it passes above the inguinal ligament, okay, so this was the inguinal ligament, so if it passes deep as in this photograph, so it is a content. But suppose if it is passing on top of inguinal ligament, then it is lying in the roof of the femoral triangle, okay. Then other things like lateral circumflex femoral artery, this is also a very important branch of the femoral artery which will come back to it again. Then also a deeper branch, like you had the profunda brachia in the upper limb, you have a profunda femoris artery in the thigh region which is coming as a branch from the femoral artery. So I hope you remember, like you had the subclavian artery which was continuing into the axillary artery was continuing into the brachial artery. So this was the main artery which was supplying the upper limb. Here in the lower limb we have this main artery, that is a femoral artery which is supplying the entire lower limb, and it is giving off a branch, that is a profunda femoris in the thigh only, okay. Then you know the boundaries already, the sartorius muscle, adductor longus, okay, so that we have discussed. So these are the boundaries and contents of femoral triangle, the most important topic of the thigh region. Then we come on to the another topic in this region, that is the femoral sheath. But before I come to this, let me bring these things in 3D. So you can see these structures now, I am putting up one by one, so you can appreciate this region, that is the femoral triangle, okay. So let me put the structures one by one, femoral artery, femoral vein, and then let me add the nerves and the lymphatics okay, lymphatics let me reduce a little bit, okay, and that's it, okay. So now first you see the boundaries, okay. So first boundary, as you can appreciate, this is a sartorius muscle, okay. Here you have the boundary, that is the adductor longus. So in this region above, so this would be the inguinal ligament here, just I'm holding it, wait, okay. This is the inguinal ligament which is forming the base of the femoral triangle, and below you have the other muscles boundaries which are the sartorius and the adductor longus, okay. So now if I show you this part, if I bring up the superficial structures again for your better clarity, so you can appreciate the first topmost fascia which we have discussed, that is the fascia lata, right. And we saw fascia lata had an opening, that was the saphenous opening, right. So in this saphenous opening you can see some structures which are exiting out, okay. So about this saphenous opening we will come back when we will discuss the venous drainage and other things. So this thing I am deliberately skipping right now, okay. Let us focus on the femoral triangle region specifically. So I am just removing the fascia lata for time being. Now you can appreciate the structure which is just in this region, femoral triangle. So this sheath like covering which you can appreciate, this is the femoral sheath, and it's a very interesting piece of structure. So you can see femoral sheath is having some compartments in the medial most. I hope you can get, this is the medial most one towards where I am sitting right now. So medial most compartment, that is having the lymph nodes. Then you move a little bit lateral, you have the femoral vein, and then you move a little bit lateral, you have the femoral artery, and then you move a little bit lateral to it, then you can see the nerve, the big thick nerve here. You can appreciate this is a femoral nerve. Can you see a very important area which I discussed just now, that is femoral nerve. It's outside the femoral sheath, okay, but there are other structures which you can see. Here is another nerve which you can appreciate. This is the femoral branch of the genitofemoral nerve which we just discussed. Can you appreciate this femoral branch is coming through? If you see carefully, this is piercing and coming out of this femoral sheath, right? So it's a content of femoral sheath, okay, but it pierces the femoral sheath anteriorly and comes to supply the skin on the front of the thigh, okay. So this is the femoral sheath, femoral branch of genitofemoral nerve, okay. All right, so now if you know these femoral sheath and its contents, okay, so I can show you. If I remove this part, you can appreciate this region. This is the femoral canal, okay. So I just want to show you one more thing, hold on. Okay, if I just isolate this femoral sheath, okay, just hold on. Okay, femoral sheath, medial femoral intramuscular septum is highlighted. Okay, let us take this femoral canal only. The femoral canal, if I try to isolate and show you, yes, this femoral canal, can you see the part of this femoral sheath here? This femoral canal is having some structure inside it, that is the lymph node of Cloquet, okay. So you can appreciate some lymph nodes, beaded structures, green color, which are visible here, okay. And the rest of the structures which we just discussed, this was the femoral artery, and you can see the branch, that is the circumflex, superficial circumflex iliac artery, okay. But here just appreciate this one, that is the profunda femoris artery or the deep femoral artery, which is going in the thigh region. So it's very important artery, which it participates in a lot of anastomosis, okay, essential supply to the lower limb, which is given off by this femoral artery. Okay. So now as we have seen the structures in 3D, it will be quite easy to understand the structures in the form of a flowchart. So femoral sheath, first we need to understand its formation. So anterior layer of this femoral sheath is derived from or continuation of fascia transversalis, and posterior layer is the continuation of fascia iliaca. I will show you in the photograph to understand this better. So have a look at this image, a very interesting image to understand this. So we have this sagittal section, right lateral view, where we are looking at, you know, this structure which you are familiar with, this is the femoral artery. So there is a structure which is the fascia transversalis here, okay, which is the just deeper structure to the abdominal muscles, like the external oblique, internal oblique, transversus abdominis, which we will discuss in the abdomen region. And you can see this inguinal ligament here with the spermatic cord. So this fascia transversalis is forming and continuing into the femoral sheath below in the lower limb, okay. And you can see the posterior layer which is formed or continuation of fascia iliaca. Now what is that? As you can imagine, the muscle which is present, iliacus, above that you have this fascia iliaca, and this iliacus muscle is present onto the iliac fossa, the region of the ilium, okay. So you can remember this is towards the posterior side and this is towards the anterior side, and that completes our femoral sheath, okay. So now you see this femoral sheath in another diagram, okay, and clinical integration of this topic is femoral hernia, okay. We will come to that also eventually. So now you see this diagram, very famous diagram for the femoral sheath understanding. So we have seen this is the femoral sheath, and you have the medial most compartment having the deep lymph nodes of Cloquet. You have an intermediate compartment having the femoral vein, and lateral most structure femoral artery and femoral branch of the genitofemoral nerve. Please remember, it's a femoral branch, not the genital branch of the genitofemoral. Okay, so femoral branch is the one which is supplying the skin over the roof of femoral triangle in the front of thigh, as I told you before. And also it acts as a main afferent for the cremastric reflex. So there is a cremastric muscle which reflex we will read about eventually. That reflex needs an afferent and an efferent. So the afferent for that reflex is this femoral branch of genitofemoral nerve. We will revise it eventually again. And also you can see this structure, that is the great saphenous vein, which is running very superficially, but it is coming out of this saphenous opening. Okay, so great saphenous vein, which we will talk about eventually in the venous drainage of the lower limb. Another concept which I want you to remember here you can see the lacunar ligament, which we will discuss in the inguinal region, but you can see the ring. Okay, so this is the femoral ring which is overlying in this region, this part. This is the femoral ring, okay, on top of the medial most compartment. And this region, the medial most compartment, if you saw in 3D also, if you remember, that entire part in the medial most area, this region was known as femoral canal. So we have a femoral ring, we have a femoral canal, the medial most one, and we have the entire femoral sheath. So there are three terminologies to understand here. Let us see the femoral sheath in another section. It was again a superior view when we are cut open and we are seeing the femoral sheath and its contents. So same structures, medial most, intermediate and lateral most, the two structures in the lateral compartment. What else you can see? You can see the posterior wall is the continuation or formation formed by the fascia iliaca, and anteriorly it is the continuation of the fascia transversalis. But what about the termination of the femoral sheath? So femoral sheath terminates inferiorly as it merges with the tunica adventitia of the femoral vessels. Frequently asked question in the exam regarding the termination of the femoral sheath. And we have already discussed the compartments, intermediate, lateral and medial compartment with its contents. Okay. And these are the two septas which you can see in this photograph, that is the medial septum and the lateral septum, okay, which is responsible for these three different compartments. And as you can see in this photograph again, medial compartment is also referred to as femoral canal. Very, very, very important. Okay, so that is the femoral canal. Femoral canal. Okay, so femoral canal, femoral sheath, okay, all these structures are important. Then we come on to the femoral canal now. Okay, so I told you femoral canal is the medial most compartment of the femoral sheath, we know that. Now this is a conical based structure which is directed upwards. We saw that also in 3D. Dimensions you can skip, not a problem. Remember the base and the others. Okay, so let me show you this. Okay, so see the base, which is the femoral ring. I told you there is a structure, femoral ring, which is forming the base of this femoral canal on the top. Okay, that ring like structure. So that is formed by having a boundaries, that is anteriorly by the inguinal ligament, anterior most structure, inguinal ligament from the anterior superior leg spine to the pubic tubercle. Posteriorly you have the muscle, that is the pectineus. Medially you have the lacunar ligament, and laterally you have the femoral vein. Let me show you this photograph again. I think you can make out. Okay, so if you talk about this photograph, you can see the boundaries of this femoral canal, that is the lacunar ligament which is present medially. Laterally you have the femoral vein. Okay, anteriorly what is the structure and posteriorly what is the structure? So anteriorly and posteriorly, you know, we discussed, that is the the inguinal ligament and pectineus, okay, which we saw previously in the other photographs. Okay, then femoral canal, this is closed by the femoral septum, which is related to the femoral fossa, and also this femoral canal is a site for femoral hernia. Okay, because see, the intermediate compartment and lateral compartment already have the major structures, the femoral artery, the femoral vein. So the relatively you have more space in the femoral canal, that is the medial most compartment. So it is the site for femoral hernia, and that is the direct clinical integration of this topic, that is femoral hernia. Okay, site for the femoral hernia. Next you see the photograph for femoral hernia. So suppose if the hernial sac has been formed, okay, so what is in the femoral hernia? The content, that is the loops of intestine basically. So you can see the peritoneum is shown here in blue color. You can see the course of femoral hernia, classical course, where you can see the structures which are being pushed from the abdomen into this area, okay, and you can see the lymph node of Floquet here. So that means we are going inside this medial most compartment, that is a femoral canal, okay. So you can see the contents, that is a loop, herniated loops of intestine, which is shown in this photograph, okay. What else is important to notice? See, you have this superior ramus of pubic. You remember the pubis bone, we can palpate that also. So this anterior to this pubic bone, you have this herniation which is happening, okay, and posteriorly you can see the pectineus muscle, okay. So this is the fascia lata, level of the fascia lata, and you can see the inguinal ligament, sorry, the inguinal ligament with the spermatic cord, and these are the abdominal muscles. So you can appreciate this region here is the herniated femoral hernia basically, which has come into this medial most compartment, okay. So that is regarding the femoral hernia. Okay, then we come on to the next content of femoral triangle, that is the femoral artery. Now femoral artery, like any arteries, if we discuss, we have to understand the beginning. The beginning is continuation of the external iliac artery at the mid-inguinal point. Let me show you this. Let us focus on arteries right now. Okay, so see this femoral artery. If I just remove the minor branches, just to show you the core concept here, okay. So see, I hope you remember this aorta, okay. This is the abdominal aorta, and this abdominal aorta is bifurcating into the common iliacs on either side. This common iliac further divides into internal iliac artery and external iliac artery, okay. External iliac artery further continues into the femoral artery, okay. So that is the main point to remember, femoral artery. So this is the continuation of the external iliac artery at the mid-inguinal point. So there is a mid-inguinal point versus mid-point of inguinal ligament. We will discuss this in the inguinal region. Then termination. So this continues as the popliteal artery by passing through the adductor hiatus. Let me show you this. So we need to bring the muscles for the same. Okay. Oh, sorry. Okay, so let me just bring the muscle there again. Okay, and the arteries. Now you see the adductor hiatus we have to see. So I have shown you this previously also in the first topic. So I'm removing the front muscles, okay, rectus and then vastus, and then I'm removing the vastus here also. Now you can see very clearly. So this is the femoral artery. Now this has to terminate. Where it is terminating, it is ending into the popliteal artery just at the adductor hiatus. So this is the adductor magnus muscle which has the opening, that is adductor hiatus. So you can see from this point onwards, when it has crossed the, or it has entered the hiatus, then it becomes the popliteal artery, okay. So now when it becomes the popliteal artery, it winds around, okay. So let me just hide these muscles. So you can see popliteal artery is going into the popliteal fossa behind, okay. So this is the main catch point. So termination, you should know femoral artery, termination and beginning, okay. Then we talk about the relations in the femoral triangle. We know that anteriorly we have the femoral sheath, posteriorly we have again the femoral sheath, and also what else, the psoas major, pectineus and adductor longus. We have seen these muscles in the floor of the femoral triangle. Then medially we have the femoral vein, and lateral to this femoral artery, please remember, we have the femoral nerve. Femoral nerve is not, it is not in femoral sheath, okay. Please remember this key point, very important point, again asked in the viva. I have repeated this multiple times in many videos till now. Then relations in the adductor canal. So now there is a canal which is known as subsartorial canal or Hunter's canal or adductor canal. We will take that up separately. That has relations, that is the anterolateral relation to this femoral artery. Anterolateral relation is vastus medialis, posteromedial is erector longus and magnus, and medial is sartorius. You remember the sartorius muscle which was running obliquely. So even if you don't remember the relations in erector canal, that is okay, not a problem, but just remember the beginning, termination and relations in the femoral triangle. Then we talk about the branches. So there are 3 superficial branches and there are 3 deep branches of the femoral artery. So number 1, we have the superficial external pudendal artery. We have the veins of the same name. Okay, we will come to that eventually. Then you have superficial epigastric, and then we have superficial circumflex iliac. So, this all superficial vessels are there. Okay. Then you have profunda femoris, I have already shown you, deep external pudendal and muscular branches. Muscular branches to supply all these muscles in the thigh region. Then clinical integration, the pulsation of the femoral artery can be easily felt, and it is classically used for checking the various pulsations in the lower limb. Also, it is important artery to do the arterial blood gas analysis, that is ABG sampling is very frequently taken from femoral artery in the ICU setups. Then you have the compression of the femoral artery, which can be a problem, and then we can use this artery for cannulation. Even in the cadavers, when you have the embalming of the cadaver, the preservation method for the cadaver. So during that procedure also, we take a nick and we cut open this femoral artery and we insert the cannula. We inject the embalming fluid through this femoral artery only. So it's a very age old technique, tested and tried formula, followed in all the medical colleges in India. So this is classically used for embalming and cannulation and other various procedures, the radiological and interventional procedures. Okay. Then you come on to this photograph. See the branches in 2D now. So abdominal aorta, I told you, bifurcating into common iliac. See, I have included maximum photographs and flowcharts so that when you revise these topics, it's a very easy thing to recap. You don't need anything else. You just need to see the main core points from the flowchart and an associated diagram to remember, because every time you cannot revise through 3D multiple times. You can just see the lecture once in 3D and you can remember for a long time. Okay. So you can see the common iliac, then bifurcating into internal and external iliac, external iliac continuing into the femoral artery, and this point from where it is continuing, that is, you can see the inguinal ligament is shown here. Okay. So this is the branch which is the profunda femoris. Now pay attention, a very interesting fact you can see here. Superficial epigastric artery which is running towards epigastrium, superficial branch. Then you have a superficial circumflex iliac, because iliac bone is here. So circumflex is always winding around. So you have the superficial circumflex iliac going in the lateral direction, epigastric one going in the up direction, and you have a superficial external pudendal. Pudendal is towards the genitals. Okay. So it's going towards the pelvic bone. Okay. So that is the pubic bone. So you can see it is going towards medially. So you have 3 different vessels with 3 different names radiating in all 3 directions. Okay. So this will be very useful when we will discuss the venous drainage, because the names of the vein are exactly the same. Okay. Then you have again the deep external pudendal artery. Okay. Then femoral artery itself, and very interestingly you can see another concept here, that is this profunda femoris artery is going here. It is giving off some perforating arteries. Okay. Along with another vessel, that is a lateral circumflex femoral artery. So see this medial circumflex femoral artery, circumflex winding around. Okay. And you have a lateral circumflex femoral. So we have a medial and a lateral, just like in humerus. If you remember, you had a anterior circumflex humeral vessel and posterior circumflex humeral, but here you have a lateral and a medial circumflex femoral artery. That's the difference, not the anterior posterior, but the lateral and medial. Another thing to remember, out of all these perforating branches, the second perforating artery coming from the profunda femoris only, this gives rise to the nutrient artery of femur. Excellently important question asked in MCQs multiple times. Okay. All right. Then you can see then you can also see the termination, that is to the popliteal artery. So there will be, here would be something, the adductor hiatus. From here onwards, the popliteal artery would be going backwards. Okay, in the popliteal fossa. So next we come on to the femoral nerve. Now femoral nerve is extremely important topic again. Itself it's a short note and very important MCQs. So femoral nerve is the largest branch of the lumbar plexus, again very important. Now see the beginning course first. So it begins or arises from the dorsal divisions of the ventral rami of L2, L3, L4 spinal nerve. So please remember a very important point here, clinical integration also, and just to understand better. See, there is a dorsal and a ventral division of the ventral primary rami. Okay, so what happens, you can see femoral nerve is supplying the anterior compartment of the thigh. Okay, you know that we have discussed this. Now femoral nerve is supplying the anterior compartment, but it is arising from the dorsal division of the ventral rami. How come that is possible? And see the contrast. Obturator nerve we will study in a while. Obturator nerve is being supplied from the ventral division, but it is coming and it is supplying finally the medial compartment. Okay, so how come this difference is there? This is happening due to the rotation. So it has an embryological basis and it is often tested in the viva exams. Okay, so this upper limb, okay, during the development phase, you know, there are limb birds. Okay, the upper limb and the lower limb has a limb bird initially, then upper limb, okay, upper limb rotates outwards, okay, and lower limb rotates inwards. So what happens when something is lower limb, if you're talking about the lower limb, so something if is rotating inwards, so what is happening, the structure which you can imagine arising from the dorsal division of the ventral rami. Okay, so structure which is present dorsally, which will come from the dorsal, it will come anteriorly. So that means, and the structure which is already present anteriorly, it will go medially. So what will happen when the rotation will happen, so the femoral nerve which was coming from the dorsal division, it will come to supply the anterior compartment, whereas the structure which was present anteriorly, which will come to lie in the medial part. So that means the obturator nerve is supplying the medial compartment. So that's the embryological basis of this supply, nerve supply. So please remember this question. So this arises from the, I am highlighting this fact, this arises from the dorsal division of the ventral primary rami of L2, L3, L4 spinal nerve. Okay, and this is due to the rotation concept. Then the course. So femoral nerve, it enters the femoral triangle deep to the inguinal ligament. We have seen in 3D also, in photograph also, in the contents of the femoral triangle. A very important fact about femoral nerve, it lies lateral to the femoral artery. Again I am repeating the same thing, it is not present inside the femoral sheath. So it is also lying lateral to the femoral sheath. Very important point, please do not skip to remember. Okay, it is lying lateral to the femoral sheath. And then we talk about the branches. Okay, so it gives off a main trunk, okay, which is main trunk which is getting the supply in the abdomen to the pectineus and the iliacus. There is a very important MCQ related to it, I will come to it in a while. Then you have the classical anterior division and the posterior division. So very easy to remember, the anterior division is supplying the muscles in the anterior part, that is the sartorius. If you remember, the main muscle which was running obliquely, that was the sartorius. Okay, so only one muscle, muscular branch to the one muscle, that is sartorius. And also we have cutaneous branches, that is the medial cutaneous nerve of the thigh and intermediate cutaneous nerve of the thigh. Okay, and then we have the posterior branches. Posterior branches are very important again. Posterior branches are the muscular branches to the rectus femoris and 3 vastae, that means the quadriceps femoris. The quadriceps femoris. Okay, so the posterior division to the posteriorly present muscles. And then you have articularis genu also, another muscle you may or may not remember. A very important nerve which is the continuation or the cutaneous branch, very important, that is the saphenous nerve. Okay, this is the saphenous nerve, very important nerve, saphenous nerve. So saphenous nerve is important. Why so? Because there is the same name vein, that is the great saphenous vein, short saphenous vein. So we have a saphenous nerve also, and that is a branch coming from the posterior division of femoral nerve. Then also there are articular branches to the hip joint and knee joint. So there are two joints, hip joint and knee joint. Okay, so let us see these important things. Also another thing, there is an artery, that is the lateral circumflex femoral artery, which we just discussed. Remember the medial and the lateral circumflex. So this lateral circumflex femoral artery is the reference point from which anterior and posterior division we are deciding. Okay, so that is the lateral circumflex femoral artery. Okay, so let me show you these things in the form of an image to better orient yourself. Okay, and also the clinical integration would be very simple. The femoral nerve clinical integration, the paralysis of the quadriceps femoris, and loss of sensations along the medial side of thigh and leg, because we are talking about the medial cutaneous nerve of the thigh and leg. What is the nerve? That is saphenous nerve again. Then femoral nerve is also followed for block, okay, for anesthesia. So now you see this photograph to understand this region of the femoral nerve. So let us see this image. Very crystal clear understanding for this femoral nerve. So the root value we know, L2, L3, L4. Okay, so you can see this main trunk of femoral nerve which is entering into this thigh region, front of thigh, and you can see the color coding has been followed for anterior division and posterior division. Red color muscles are shown, and then green color nomenclature is shown for the anterior division. Okay, so now see another important thing. The main trunk of femoral nerve is giving off the supply to two muscles. One is the iliacus and one is the pectineus. We have already studied the names of these previously, and these two muscles are the ones which are supplied by the main trunk of femoral nerve. Very easy question, right? But if the question is specifically asking, MCQ is asking, which is the muscle supplied by the main trunk of femoral nerve in the iliac fossa, so the correct answer would be iliacus only. Okay, this has been asked in the previous exams, so please remember. Then you can see the further branches which we have already discussed to the muscles and posterior and then anterior, and you can see this red dot which I have shown here. This red dot demarcates the presence of lateral circumflex femoral artery, with respect to which we are saying anterior and posterior. Okay, then see another nerve here, that is the saphenous nerve. Now saphenous nerve, I told you, is very interesting. Saphenous nerve supplies the skin on the medial side of leg and foot till the great toe. So imagine in your body, great toe is towards the medial side. So saphenous nerve is running till that point. Okay, so that means if there is injury, a nerve injury to this saphenous nerve is cut, so what will happen? There will be loss of sensation over the medial side of leg and foot. So why not thigh? Because for thigh we already have this nerve, that is the medial cutaneous nerve of thigh, which is coming from the anterior division, and this saphenous nerve is coming from the posterior division. So posterior division is supplying the leg and foot region medial side, and the thigh region medial side supplied by the anterior division. Okay, so very easy. Please remember it as per the photograph so that you can easily remember. Then you see the two joints, the hip joint and the knee joint. Both are again having the supply by the femoral nerve. Okay, so the same things which I have just told you, I have written below so that you can revise later. Okay, before we jump to the next topic. So two muscles which are supplied by the trunk of femoral nerve, that is the iliacus and the pectineus. And if the question is regarding the only muscle supplied by the trunk of femoral nerve in the iliac fossa, specifically iliac fossa, then the correct answer becomes iliacus only. Also another thing, saphenous nerve which we saw is also running along the great saphenous vein. We will discuss the venous drainage of lower limb. That is responsible for the referred pain of hip joint to the medial aspect of leg and foot. Why leg and foot? Because of saphenous nerve supply. Not the medial side of the thigh, because that is supplied by the MCNT, that is medial cutaneous nerve of thigh. Okay, and you should also know the Hilton's law here. Hilton's law states that the nerve supplying the muscles overlapping any joint will also give a articular twig to the joint. Articular means towards the joint. Okay, so that we have seen in this photograph again. So hip joint, so this nerve is giving articular twig to the hip joint as well as knee joint. So that is why it is responsible for the referred pain from the hip to the knee joint. Okay, So please remember this regarding these things regarding the femoral nerve. Okay, so that's it. Then we move on to the next topic, that is the medial side of thigh and adductor canal.